Afternoon, everybody. Again, my name is Michael Taylor. I work in the Adult Substance Abuse Program at the Alliance Center for the West Simpson General Hospital. Lynn Peddle was my director, but she came to me a couple months ago and said, I'll be on holidays. She's in the Bahamas today. And when I woke up this morning, I realized that I wasn't in the Bahamas. I think it's the coldest day of the year. So just a brief summary of the services. What's really neat about the Alliance Center is all of the services are basically under one roof, and it's a really great model. And we're always collaborating with other agencies to kind of build on that model, right? So just the arrow keys, so within the Alliance Center, we have mental health counseling. Services are offered for our mandate is 16 and up. But we have a no wrong door policy. If somebody came to us, we would definitely get them connected to the appropriate service. I heard that no wrong door term this morning. So it's our mandate is to seriously mentally ill, but they could come with other illnesses. We wouldn't turn anybody away. So there's 2 mental health counselors now. I mean, wait times are an issue for any agency, but we really do pride ourselves on getting creative about wait time. So we have a walk-in clinic now. I'll get into that a little bit later. We have groups that will help alleviate some of the wait times. So even though there are technically wait times, there really isn't a wait time, and people could access services right away through the walk-in clinic or groups. So there's substance abuse counseling. There's 2. There's youth, 16 to 24, and then there's myself, 24 to 99. It's available to people 16 years or older. Counseling is offered for significant others, so people that are affected by other people's substance use too. So we do a lot of assessment referral. We have harm reduction services, so we have a needle exchange program that we've opened up a couple of years ago. We work well with the municipality as well too. For needle drop-offs and naloxone kits, naloxone trainings. We also do a lot of community treatment, one-on-one treatment. Sorry, I went backwards there. So we've opened up a RAAM clinic, an addiction medicine clinic, probably almost 2 years ago now. That's doing really well. Again, it's to alleviate times for access to services, right? So we have access to Dr. Lalonde in the community. We have access to Dr. Desorme, who meets with us on every Tuesday. That's, there's an ever-growing need. It's a very brief service, and I mean, that's by definition RAAM, rapid access to addiction medicine. We try to keep that to 4 or 5 appointments. But more importantly, the research says that when people are connected to a service afterwards, they tend to do better, right? So we really strive to do that. Must have hit that. So case management services is offered to the people experiencing seriously mental illness. The case managers are out in the community about 80% of the time. All of the services are offered in a bilingual atmosphere as well too. It's supportive counseling, referrals, advocacy, all the things that a case manager would do. There's a crisis intervention program that runs from 4 to 11, 7 days a week. Again, people 16 years and over. If it would be not within the working hours, they could still present to the West Simpson General Hospital ER department if they were in a crisis. There's literature that they could access crisis situations or the crisis intervention in North Bay. It's a program that benefits short-term crisis counseling and intervention, as well as assessment to appropriate referral. So even if they did present in a crisis, they would make a referral afterwards, to most times to ourselves or to another agency within the community. Psychiatric services are provided through the Ontario Psychiatric Outreach Program. So we have special funding for francophone services for psychiatry. We have Dr. Nadeau has been with us for many, many years. We've had Dr. Richards, Dr. Danielle with us over the years too as well. The model works that you have to be attached to a clinician to access psychiatry there. We also have like a symptom monitoring program. We've, I guess about a year ago, before COVID, we had the walk-in clinic. So again, that's a creative way to address wait time. So I think the average wait time for mental health services is about 6 to 8 months. The substance abuse program doesn't really have a wait time. But again, people could be on a wait list for mental health services, but start meeting with a mental health counselor right away, right? And lots of times we found with the walk-in clinic that a lot of people's needs were met right at that level of care, and maybe they didn't need to go to extended therapy, right? Group sessions is another creative way to offset wait time. So we have, but not limited to, self-esteem, anger management, substance misuse, all kinds of topics. All of this stuff is posted on the West Nipissing General Hospital website too, if anybody wants to access this information. Referrals can be made by physicians, individuals, family members. People can self-refer. Again, bilingual services, 16 years and up. Services are offered in person, by phone, through televideo. With COVID, we've had to get really creative. We use OTN, which is a secure platform. Individuals must reside within our catchment area. Jocko Point, Monettville, we've gone as far as Dokeys. So, but again, if you were from a different area, there would be no wrong door. I would certainly get you connected to another service. And I think that is pretty much, and our mission statement. Our mission statement at the Alliance Center is to promote improve quality of life, self-esteem, empowerment to all persons in the West Nipissing community through the delivery of culturally diverse, bilingual mental health, substance abuse, and mental health services.